Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Adalberto Castellanos, who is a gastroenterologist with Baptist Health. Welcome.
Hi, thank you for having me, Dr. Fox.
Now, when I started, I said colon cancer, and we're going to talk about that. We've talked about it several times on the show, but it's getting more frequent in young people?
Yes, for reasons that we don't entirely understand. The incident, what we call early onset colon cancer, that means people below the age of 45 or 40 has skyrocketed. The prediction is by 2030, we're going to have maybe 10 to 15% of colon cancers will be in persons under the age of 40, and maybe 25% of rectal cancers will be in that age group also.
Does that change the screening recommendation? Do you start early?
Yes.
Now?
So some years ago, the guidelines changed in recognition of that fact. And so until a few years ago, we would start screening average risk individuals that did not have risk factors for colon cancer. We would start screening at age 50. And in recognition of those new statistics, we start screening at age 45 now.
Okay, now you say screening,
right.
And colonoscopy is the gold standard. We've talked about that. We've encouraged people to get it, but there are other methods.
Correct.
Tell us about some.
Right, so just to kind of go over what you just said, colonoscopy is considered the gold standard. I would say that nowadays one of the things we encounter very commonly is the Cologuard test, and many individuals do undergo the Cologuard testing, which is a stool-based test. And these are, people submit their stool samples to the lab and they get a result back. What I have found with the Cologuard is many times we'll have a patient that has had a Cologuard, and if the Cologuard test is positive, that needs to be followed up by a colonoscopy, because a positive Cologuard, until proven otherwise, is a colon cancer. So as we do a follow-up and I meet these patients that have had a positive Cologuard test, I'll ask them if they understood the test. And what really has caught my attention is how frequently they don't understand the limitations. So for example, while the Cologuard test will find about 94% of colon cancer, or 92% in the best case scenario, there are some papers that have shown it to miss as many as 15% of colon cancers. Most people do not understand that. They think it's, for some reason, they think a lot of times it's 99%, not entirely sure why. And a colonoscopy can miss, on the high side, 3% of colon cancers, but most of us will say that it's less than 1% of colon cancers. So to make a comparison, if we take an average number for Cologuard, misses maybe 10% of colon cancers. Colonoscopy misses, let's say, maybe less than 1%. We're talking about a Cologuard missing 10 times more colon cancer than a colonoscopy. I think that catches a lot of people's attention when we explain that to them. But the other thing I think is really important is we always ask people, would you rather find colon cancer early, or would you rather prevent it? And obviously the logical answer is, well, we'd rather prevent it. And then when we point out that the Cologuard really does not have any potential for preventing colon cancer, then again, that catches our attention. So we're finding that a lot of people have not been properly informed as to the limits of Cologuard, in that it does not provide any preventative value, and it has a much lower chance for finding colon cancer than a colonoscopy.
Okay, now one thing you didn't mention, and it's pretty new to me, and I think is just developed, is the blood test.
Right.
Is it helpful, or should it even be used at this point in time?
Well, back to the same issue with the Cologuard, it's the miss rate. So the blood-based test can miss, based on some papers, almost 25% of colon cancers. So now we're talking a 25-fold increase in missed colon cancers compared, for example, to a colonoscopy. So I think it's very limited. I think people get excited about, well, hey, we can do what's called a liquid biopsy and simply draw blood and see if they have a colon cancer again. But again, we're back to the same issue. Really what we want to do is colon cancer prevention. And I think one of the things that has happened over decades is that the term colon cancer screening has become embedded in our culture. People always hear, I want to get my colon cancer screening, But really what we should be doing is colon cancer screening / prevention. And when you throw that prevention word in, these tests like the blood-based tests and the stool tests go away because they don't really have any value. So back to the same issue with the blood test, it detects maybe 10% of polyps. The Cologuard about less than 50%. And so you're missing the chance to really prevent colon cancer.
Colon cancer. Okay, now, I have some patients, though, that they say, I'm not doing a colonoscopy, period. I'm not going, and no matter what I do, and they're not going to do it. So I would say to those patients, if you're not willing to do that, do something, and one of those tests might be an option.
Right. Well, again, yes, that absolutely for somebody that says it, but they have to understand that if that test comes back positive, they have to be willing to have the colonoscopy. And you know, in years past, what we've run into is your insurance a lot of times will cover a screening test, whichever one it is, the Cologuard or the colonoscopy, not the blood-based test yet. But what happens is if you come back with a positive Cologuard and then you have a colonoscopy, the colonoscopy, sometimes the insurance does not consider it a screening test anymore.
Because you've already had that.
Right. And so, and the reason that makes a difference is in Kentucky, by law, with some exceptions, the colonoscopy or your whatever screening test you have does not go to your copay or your deductible. This is to incentivize people to do it. If they come with a positive Cologuard, there's a chance that their insurance will no longer cover it as a screening test.
Okay. Well, thanks for all you do. Thanks for the patients, and thanks for the colon cancer that you prevent. Appreciate you coming in.
All right, thank you.
We'll be right back.